Welcome to another nursing video. This will be a crash course on cardiovascular disorders. We're going to go over 12 key cardiovascular disorders that are frequently covered on both the Nclex and nursing exams. Now, for each condition, we'll discuss the definition, manifestations, common treatments, and nursing interventions. Let's begin. Angina. Angina is transient chest pain caused by myocardial ischemia without infarction. Signs and symptoms include the following: chest pain or pressure, often triggered by exertion or stress. Pain may radiate to the jaw, neck, or arm. It's relieved by rest or nitroglycerin. Treatment includes the following: sublingual nitroglycerin for immediate relief, beta blockers and calcium channel blockers for prevention, and lifestyle changes, including smoking cessation. Nursing interventions are to teach the patient to carry nitroglycerin and use it at the onset of pain, and to monitor for pain characteristics and response to treatment. Myocardial infarction. Myocardial infarction is prolonged ischemia causing irreversible myocardial damage. Signs and symptoms include severe chest pain unrelieved by rest or nitroglycerin, nausea, diaphoresis, dyspnea, and anxiety. Also, ST segment elevation or T-wave inversion on ECG. Treatment includes morphine, oxygen, nitroglycerin, and aspirin. Additional treatments include thrombolytics, percutaneous coronary intervention, or coronary artery bypass graft. Nursing interventions are to administer prescribed medications promptly, monitor vital signs, cardiac rhythm, and pain, and educate about cardiac rehabilitation and lifestyle changes post-MI. Heart failure. Heart failure is the heart's inability to pump blood effectively, resulting in inadequate perfusion. Signs and symptoms include, for left-sided heart failure, pulmonary congestion, crackles, dyspnea, and orthopnea. For right-sided heart failure, peripheral edema, ascites, and jugular venous distension. Treatment includes ACE inhibitors, diuretics, beta blockers, and digoxin, as well as fluid and sodium restriction. Nursing interventions are to monitor daily weight and fluid balance, elevate the head of the bed for respiratory relief, and teach the patient about medication adherence and fluid restrictions. Valvular disorders. Valvular disorders are the dysfunction of heart valves, causing stenosis or regurgitation. Signs and symptoms include murmurs, dyspnea, fatigue, and palpitations. In advanced cases, there may be signs of heart failure. Treatment includes medications to manage symptoms, such as diuretics and anticoagulants. Additional treatment options include valve repair or replacement. Nursing interventions are to monitor for signs of heart failure or embolism, educate on anticoagulant therapy for mechanical valves, and encourage adherence to prophylactic antibiotics before dental procedures. Aortic aneurysm. An aortic aneurysm is a localized dilation of the aorta due to weakened arterial walls. Signs and symptoms include chest or back pain and hoarseness if thoracic, or a pulsatile abdominal mass, back pain, or brute if abdominal. Treatment includes surgery for large or symptomatic aneurysms and aggressive control of hypertension. Nursing interventions are to monitor for signs of rupture, such as severe pain and hypotension, and educate about regular follow-up imaging and avoiding heavy lifting. Hypertension. Hypertension is the persistent elevation of blood pressure more than 140/90. Signs and symptoms are often asymptomatic but may include headache, dizziness, and blurred vision in severe cases. Treatment includes lifestyle changes such as a low-sodium diet, exercise, and smoking cessation, as well as medications. Medications used are ACE inhibitors, diuretics, and calcium channel blockers. Nursing interventions are to monitor blood pressure regularly and educate about the importance of medication adherence and lifestyle modifications. Peripheral vascular disease. Peripheral vascular disease is arterial blood flow obstruction, typically caused by atherosclerosis. Signs and symptoms include intermittent claudication, cool skin, weak or absent pulses, as well as ulcers on toes or feet. Treatment includes antiplatelet agents, statins, and angioplasty. Also, smoking cessation and exercise programs are encouraged. Nursing interventions are to educate on proper foot care and smoking cessation, and to promote supervised exercise to improve circulation. Peripheral venous disease is impaired venous return, often due to valve dysfunction. Signs and symptoms include leg edema, skin discoloration, and aching pain. Treatment includes compression therapy, leg elevation, and sclerotherapy for varicose veins. Nursing interventions are to teach patients to elevate legs, wear compression stockings, and avoid prolonged standing or sitting. Venous thromboembolism. Venous thromboembolism is blood clot formation in veins, risking pulmonary embolism. Signs and symptoms include swelling, redness, warmth, and pain in the affected limb. Treatment includes anticoagulants such as heparin, warfarin, and thrombolytics. Nursing interventions are to encourage early ambulation or use of sequential compression devices, and monitor for signs of pulmonary embolism such as sudden dyspnea. Varicose veins. Varicose veins are dilated, tortuous veins caused by valve dysfunction. Signs and symptoms include leg pain, visible swelling, and heaviness. Treatment includes compression stockings, sclerotherapy, or vein stripping. Nursing interventions are to educate on lifestyle changes like weight loss and leg elevation, and also to promote regular physical activity. Buerger's disease. Buerger's disease is an inflammatory occlusive disease affecting small and medium vessels, often in smokers. Signs and symptoms include pain, ischemic ulcers, and gangrene. Treatment includes smoking cessation, vasodilators, and pain management. Nursing interventions are to emphasize the need for smoking cessation and to monitor for signs of infection or gangrene. Raynaud syndrome. Raynaud syndrome is the vasospasm of small arteries, often triggered by cold or stress. Signs and symptoms include white, blue, and red phases of color change in fingers and toes. Treatment includes calcium channel blockers and avoiding cold exposure. Nursing interventions are to teach patients to keep extremities warm and avoid triggers, and to educate on smoking cessation and stress management. Cardiovascular conditions are diverse and can range from chronic issues like hypertension to acute emergencies like myocardial infarction. Understanding their manifestations, treatments, and nursing interventions allows us to provide effective care and educate patients on managing their conditions. Well, that ends this video. Thanks for watching. Here's another nursing video.